This whole scheme is a scheme to support people that are involved in improvement, to give them some tools that will help them, and also an improvement coach for the full 20 weeks. And it's been fantastic hearing the wide variety of improvements that have been made, how they've been sustained, and how they've engaged all of the staff and patients in those improvements.
What we wanted to do was set up a social media hub for patients in North Cumbria to be able to share information with them around respiratory disease, around living well, around managing their conditions. Through the Engaging for Improvement project, we've been able to identify how we were going to go about setting this up, and it's given us the tools to be able to develop the project successfully.
So my project really was my postural care passport, and the aim of my passport really was to improve the sharing of information between the enormous amount of people that are involved in a person's care. When you have a profound and multiple learning disability, there's lots and lots of people, and actually we all need to be speaking the same language and sharing the same information. The passport was a way to try and do that. I couldn't have done it without CLIC. It would still be an idea in my head that I had probably 7 or 8 years ago. And actually it's taken this project to bring it forwards.
It's great to see so many people and so many people talking about improvement, putting patients right at the centre.
My project today was electroconvulsive therapy pathway for our patients to have access to electroconvulsive therapy for treatment-resistant depression. It's about empowering our staff, bringing our staff together, working together with psychiatrists, clinicians, with other teams, community and inpatient, to provide this treatment pathway for our most vulnerable patients who require it.
We also looked at some rapid schemes, which are around rapid process improvements. Now, these schemes work with services over a week-long 5-day workshop to really target a specific improvement issue.
And what we were looking at doing 4 years ago is working together across our organisations in Cumbria to identify how we could work better together and improve services for the people we serve. One of the tools that we used was patient journey mapping, so that's very much identifying what the experience was like for those individual patients and where there was challenges to our services and where we could improve.
It isn't a top-down approach at all. From every individual within the ward, it just gave them that confidence and courage and the belief that they could make a difference to patients and to each other and to staff.